Domestic violence. We read about it, we witness it, sometimes we experience it. But do we know how to respond to an instance of domestic violence? As a healthcare provider, are you equipped to respond to a survivor who reaches the health facility or discloses to you?
Domestic and intimate partner violence are huge problems in India. Women are subjected to many forms of violence by their families as well as their partners. This leads to several health consequences for women as well. Women face physical injury, emotional trauma, and sexual and reproductive health consequences due to domestic violence. In many cases, domestic violence can also be fatal. In many cases, we consider sexual violence and physical abuse as domestic violence, but it is important to remember that verbal abuse, emotional abuse such as forced isolation, financial abuse also constitutes domestic violence. For instance, when women are stopped from having their own bank accounts, it is a form of domestic violence that takes away their mobility, autonomy and independence. As we understand the definition of domestic violence, let's stress on one very important point. There is no excuse for domestic violence.
Inflicting violence on another human being cannot be justified under any circumstance. Many people blame anger, stress, alcohol, drugs, mental illness, etc. for their violent behavior. Many go as far as to blame the victim. They say the victim made a mistake or provoked the abuser into inflicting violence.
Popular media reinforces the message that domestic violence is okay if the person in question, usually a woman, has done something wrong or hatched some plot. But it's really important for us to unlearn these toxic messages. Violence is never okay and it's never the fault of the victim. Domestic violence can affect anybody irrespective of their age, class, caste, gender or religion. Studies show that 1 in 3 women experience some sort of domestic violence during their lifetime. Unmarried women also experience violence from their live-in partners as well as from their families. Studies also indicate that pregnancy is not a protective factor against violence. Women often experience escalating forms of violence during and after pregnancy.
A medical practitioner is alerted to the possibilities of domestic violence when certain signs are noticed in the patient. Some common signs are bruising in the chest and abdomen, multiple injuries, minor lacerations, ruptured eardrums, patterns of repeated injury, and delay in seeking medical attention. Other health issues where a medical practitioner also considers possibilities of domestic violence include stress related illness like anxiety, panic attacks and or depression, psychiatric illness, sleeping and eating disorders, suicide attempts, chronic headaches, asthma, vague aches and pains, abdominal pain, chronic diarrhea, joint pain, muscle pain, sexual dysfunction, vaginal discharge, or gynecological problems, miscarriages, or chronic pelvic pain, drug abuse, including tranquilizers and alcohol.
As a healthcare provider, you're one of the first people who are going to come into contact with a domestic violence survivor. So it's very important for you to know the signs for early identification of survivors, and it's even more important for you to know the do's and don'ts of approaching a survivor.
Be sensitive. Remember that every woman's situation is unique. Broach the subject carefully in a place where he or she is alone with you. Listen carefully and without judgment. Do not ask questions like, "What did you do to provoke him?" Or give advice like, "You should have listened to him," or "You should be more adjusting." Do not look for reasons of abuse. There is no excuse for violence. Reinforce the fact that no matter what happened, it is not their fault that they faced violence.
Remember these 4 key points when you're talking to a survivor. Always listen to them without interrupting. Communicate to them that you believe in what they are saying. Appreciate their courage in coming forward and talking about their experience, and validate what they're feeling. Maintain the confidentiality of the process. And finally, make sure to tell them that the violence is not their fault and violence is never acceptable no matter what the circumstance.
As a nurse, it is important for you to assess the situation well. Is the abuse currently happening or was it in the past? Accordingly, what are the safety risks to the survivor right now? Inform her about helplines and shelter services that she may use. Develop a safety plan in consultation with her. Admit her at the hospital if there is a threat to her life.
So if the situation gets really bad, survivors may decide to leave. At this point, what is your responsibility? You need to make sure to plan the next steps with them, keeping their safety in mind. Make sure to refer survivors to psychosocial support services in your city. Also, when you're speaking to survivors, make sure to tell them that you believe them, that they are not at fault, that their clothes, that their actions have not contributed to the violence in any way.
It is important to encourage the survivor to take someone into confidence so that she has support once she goes back. Keep all original documents with you or in a safe space. Keep copies of these documents with you. Children should also be taught what to do in case of an emergency. Give them clear instructions on whom to call and what to say. The next step is to plan an alternate place to go to in an emergency. Call the emergency number or step out of the house. Seek support of someone you trust.
Survivors have different ways of coping with a violent situation. Even when women are facing extremely violent situations, they always have the capacity to deal with it. It is important to provide suggestions and options for women, but never ever decide for them. Make sure to offer women psychological support, respect her decision, and refer her to further support if she needs it. Keep a list of referral services at hand and make sure to tell her and yourself that it's never the survivor's fault.